And tonight, extra focus on treating COVID-19 patients. Doctors are encouraged by the success of new therapies to treat those who are hospitalized and by the decreasing number of new patients they're seeing come through their doors.
Now, the graph you see here will show you on is shown on the EP Strong website. You can see it right here. It shows that the average number of people being admitted to the hospital daily in the county has actually been declining, as you see over there, hitting a peak at 37 daily new admissions, the rolling average in mid-July. Now, Stephanie, UMC officials actually told you that just this week, 17 patients were discharged in one day alone.
Right, Eric. I spoke with UMC's Chief Medical Officer, Dr. Joel Hendricks, about the decrease in patients and the treatments for those who remain hospitalized. Hendricks credits the use of remdesivir and steroids for quickening recoveries. Now, steroids have been used to help lung development in premature infants.
So the steroids decrease the amount of inflammation that's occurring during certain parts of this disease process. So we've learned when is the optimum time to give it and what patients to give it to. Because if you can decrease that inflammation, then you are able to save some of that lung tissue so that they're able to heal quicker and be able to go home quicker.
And UMC sent us this video from inside the hospital. The red flags serve as visual cues of the airflow in the COVID units. Dr. Hendricks said the goal is to help keep the patients in these rooms off ventilators, since data show that patients on a ventilator have a higher risk of dying. Hendricks believes they would be able to help more patients with convalescent plasma. The only way to get it is through donations by people who have recovered from COVID-19 and have antibodies in their blood.
Right now, unfortunately, we just don't have a lot of convalescent plasma available. So we highly encourage those who have been exposed to it to please donate. Vitalant is there, ready, and it doesn't take much to give those antibodies so that we can utilize them in our hospitals to treat those individuals so that they will get better quicker.
Now, a vast majority of the victims had underlying health conditions such as heart disease and diabetes. As the pandemic continues, Dr. Joel Hendricks has advice for everyone who hasn't contracted COVID-19, Stephanie.
Yeah, Eric, he says we should all strive to prevent or reverse any existing health conditions with a healthy diet, moderate exercise, and rest. And he urged everyone to keep up the use of masks in public, hand washing, and social distancing.